Welcome to the Healthcare IT Today CIO podcast. I'm John Lynn, the founder and chief editor at Healthcare IT Today. I'm excited to bring you the most practical healthcare CIO insights and perspectives. We know your job is challenging and we want to help you be more successful. And our guest today is Eric Lee. He's Chief Health Information Officer at AltaMed Health Services. Welcome, Eric.
Oh, thank you, John. I've been a long-time listener of the CIO podcast and honored to be here with you today.
I appreciate that. I always love when listeners become guests and guests become listeners. It's a virtuous cycle. Yeah, well, we're here at the KLAS Arch Collaborative event. Lots to talk about here as far as user experience and satisfaction. But before we go there, tell us a little bit about yourself and AltaMed.
So I'm board certified in internal medicine and clinical informatics. I've been with AltaMed almost 8 years now. And, I was brought on to clinically oversee our Epic implementation. Ray Lowe actually hired me and brought me on board. So it's been quite a journey in our 7 years being live on Epic now. We've achieved a lot through growing the clinical informatics team, and then also just partnering with operations in a lot of different projects and efforts. Prior to that, I was, and then AltaMed Health Services. So nation's largest federally qualified health center. We have several 100,000 lives in LA and Orange counties. We also have an embedded IPA within our FQHC. And then we have several other entities. We have a for-profit MSO. We have a Medicaid insurance product operating under a restricted knox-keene license and a nonprofit foundation.
Amazing. Well, AltaMed's doing some great work, and we should save Epic for another day when we'd have lots to talk about there. But we're here at the KLAS Arch Collaborative event and talking about user experience. But what's been your experience with the KLAS Arch Collaborative?
It's been a great experience so far. We're in the midst of a 3-year membership, and I've wanted to become a member of the KLAS Arch Collaborative for years, and I think it's important to see where you stand or where your EHR system stands, so as an external validation point. And I think it's also there's so much importance and emphasis on training. You can train so many different ways, but you don't know or get that feedback that often in terms of, are you doing it well, or what could be better about how you do it, right? And so I think getting that sort of a detailed survey feedback, right? Feedback is a gift, right? So getting that detailed survey feedback is tremendously helpful.
Yeah, and I imagine some of the benchmarks are interesting too, right? Because you can do your own survey, but if you survey, you're like, well, is that good or bad? What's nice about KLAS Arch Collaborative, they've surveyed a lot, and you can say, oh, how am I doing against my peers? Am I training good? Do I need to improve it? Is that kind of the thinking as well?
Yeah, so KLAS offered several different cohorts for us, which was good to compare, right? We wanted to be compared against FQHCs. We also wanted to be compared like ambulatory organizations as well as organizations on Epic. So they were able to offer, like, slice and dice those different views for you.
Awesome.
So knowing how you fall, right, within the several of those metrics and benchmarks is important.
Yeah, for sure. So what are some of the results that you saw from the survey? What did you find? That you just finished your first round of it. What did you see from the results?
So, the results were overall, I was shocked. Like, really shocked. Results overall were very positive. Obviously, there are opportunities, which I'll talk about in a second. But yes, pleased to say, we, in our initial survey attempt, we won the Pinnacle Award for both our physicians and nursing. So that's, just a testament. I think, we are doing more things right than wrong, or right. So I think there's always opportunities for improvement, right? And I think one of them is, we found that there are nurses who are frequently saying there's like 3+ hours of unproductive, non-value-added charting or documentation, right?
Wow.
So now it's going to be a deep dive into it with the nurses on my informatics team of, okay, where are we going to start trimming some of the non-value, what's considered non-value-added, right? Doing that survey, figuring out what alerts don't work, right? So there's always opportunity there. There's also feedback on training. Folks wanted a little bit more flexibility in terms of training. Even for new hires, when they're onboarding with us, some roles require like 5 different classes. And if you offer them all in person, you're really limiting how much they can do and when they can start using Epic, right? So figuring out how can we be more flexible, how can we be more versatile, and I think that would have helped us as well during our recent system-wide network event. Not being able to offer like flexible, because onboarding, like new hires onboarding and starting at the company still happen during an event when your systems are down, right? So you got to figure out how are you going to train them and have that flexibility.
Yeah.
So just a couple of the opportunities we saw.
That's interesting. I mean, is that how you're approaching the results? Obviously I've been to KLAS Arch Collaborative for 3 or 4 years in a row myself, and I've seen how they survey, and training's one of them, onboarding, is another. They assessed voice recognition originally, and found actually it didn't help. Which it kind of made sense, right? You're like, oh, the people who want to do the least customization have to do the hardest thing. Now they're doing AI scribes. I'm interested to see. I haven't been to as many sessions this year to see the impact of that. Is that how you're kind of approaching it? Is like, where are the areas that you can improve in training, AI scribe, those types of things? Or are there other areas that you're looking to, really, be able to implement some changes and improve your user satisfaction?
So yes, we did, implement AI scribes with a bridge, and it was, particularly helpful for us in that we wanted to see what was the impact from the KLAS Arch Collaborative perspective, right, in the survey. We actually worked with KLAS to add in several AI-focused questions, right? Because there's a base template that you have.
Sure.
So you're able to compare apples to apples across the nation. And then there's the ability to add a few custom, right, configuration type questions that you want to make sure you're targeting for nursing, for providers, for different roles as well. So we added a few on AI and what their thoughts were on that. And I think it's, that was one of the really positive feedback that we received was, this was one of the best things that happened, right, in the past year. So, I think that's, some of that was, very helpful, right? But,
and I want to dive into that, but before we go there, I would love to understand, in fact, maybe let's go there. Talk to us about the recent project you had, and that you've worked on at AltaMed, to successfully implement the AI scribe. What went into the project? What do you think made it a success? What were some of the challenges you had to overcome?
Yeah, so I will talk about a bridge again, right? Because I think that's a project that continues to be very successful for us at AltaMed. So, we were originally slated to implement at the beginning of last year, but the LA wildfires and our organization system response to the wildfires had us kind of postpone it a little bit, right? So then we focused on announcing this in April at our all provider conference. Several hundred folks in the room, and we had Dr. Shiv Rao come from a bridge to give a keynote on what is AI and what does the future look like. And then I had 2 docs on my clinical informatics team do this demo, and one of the docs is actually trilingual.
Oh wow!
Yeah, like Mandarin, Spanish and English, right? Of course, but so she grew up near the Mexico border, and this Dr. Viviana Huang Chen, she was amazing. She was the patient and knows all the Spanish colloquialisms, was speaking in Spanglish, Spanish, and just did such a great job of acting as a patient. Dr. Jeff Arroyo is also, he was acting as a physician. So they go through this visit and, they have the audience in titters. I mean, literally, right? Just because they were talking about a superhero theme and going through all these and making all these phrases up and the like. So after that, then they say, let's see what the note looks like. And of course, it does it flawlessly. The C-suite, our executives were sitting right there. They were just amazed. Our providers were, they were blown away. And they were saying, what do we need to do to sign up? This becomes a little bit of a, I think marketing and how you sell this is really important.
Yeah.
And I think making sure they connect, right, and engage with the story or how you're presenting it, I think is really important to them having that different mindset of, okay, this is something different. I think this will help me, and it's worth trying it out, right? It's worth going through the effort to sign up and then trying it out. And so, we still have over 300 of our providers using it consistently.
Wow.
And it's about 2/3, almost 3/4 of our providers are using it regularly. And then out of that group, we have almost 2/3 of them using it more, like 70% or more of their visits on a daily basis. So we're getting, really consistent usage and high usage as well.
That's amazing. I don't think when you went through med school, you probably thought, like, oh, I'm going to be a marketer, right? And need these marketing skills. But you're right. That is, so it's great you're getting such usage. Were there any other challenges you had implementing it that you had to overcome to really make it a success? Legal, compliance, or any other things?
So, so I think to go fast, you have to sometimes go slow, right? And so I think one of the things I was focused on was working with legal. And they were so helpful, right? But in working with legal, I'd like to draft, there's a provider responsible use agreement for using AI. And in it, you have to basically educate them, right? So you want to educate the provider of what they need to know to use the tool responsibly and to use it appropriately.
Sure.
And so there's that AI literacy component you're addressing. Then you're talking about the fact that in California, you have to ask for consent before you record because it's a multi-party state.
Yep.
So that's part of the agreement is you will always ask for consent. Another aspect of it is that you will attest at the bottom of the note that you co-created this with generative AI and that you carefully reviewed the note, right? So it's, again, part of that principle of the human being in the loop, and you always have to check that and verify that. And the last aspect was, this is just something I learned from a prior Dragon, speech-to-text dictation implementation I'd done in my prior life, and that was no umbrella clauses, right? So you're not allowed to have these umbrella clauses that excuse you for errant mistypos that may have happened as a result of the AI and blame it on the AI, right? You can have an iPhone autocorrect, phrase in an email, but you can't have that in a medical progress note. That's not acceptable. So I think those are the things I wanted to make sure our providers were signing before then they got access to a bridge.
That's really interesting. You may have addressed some of it there, but like, what do we now understand about AI in general, not just legally, but like in general, like what do we understand about AI in healthcare, and maybe what are some things we're still trying to figure out, like as you look at how AI can help the patients at AltaMed?
Yeah. So, I think we're at this point where it's tip of the iceberg still of what we can do with AI. I think AI is really great at knowledge retrieval and framing what's been discussed, so it can make you really efficient in that regard. There's a lot of opportunity, right? So, there's frequently my colleagues across the country are, when they're trying to get approval for their ambient AI scribe, they're often asked by the CFO, like, so what's the ROI in this? How are you going to pay for this, right? Are you going to ask them to see more patients? And again, it's in this day and age, how many more things do we ask the physician or the provider to do, right? So just because you're taking dictation or the need to create a documentation and the need to create a note off their plate doesn't mean that you addressed all the other things in the increasing heap of tasks that you've asked them to do, and that shouldn't result in you having to see more patients. This is really table stakes of what you need to have across the country. I think it's just going to be table stakes to be able to recruit and be able to retain the workforce and to prevent burnout or to help alleviate some of those aspects of burnout. But, there's, getting back to the question, there's so much opportunity, right? So just in a provider visit alone, for example, there's the task of documentation, right? So I can engage and, have more face time with a patient. But what about orders? What about updating my problem list? What about drafting the prior auths or the referrals for me? What about creating that summary for me so I don't have to spend 5-10 minutes looking at all the notes in the chart trying to figure that part out? What about billing? What about HCC, hierarchical, categorical?
Right.
condition coding, right? So that you have to do on Medicare patients. All of those tasks happen, and some are done well, some aren't done well with AI. And so those are the additional opportunities of how I can really become more efficient.
Yeah,
So.
absolutely. I mean, there's so much going on, right? I think that's one of the challenges is how do we prioritize it? How do we pay for it?
Yes.
To your CFO question.
Yeah.
But you're right. And it will be interesting here at KLAS Arch Collaborative, those who implement medical AI scribes, right, and automation like that versus those who don't.
Right.
And how those scores are going to, we're going to see it in the data. So that's going to be interesting to see over the next couple of years.
The other thing, another shortcoming of AI, right, is I was at a conference last week and speaking with some of the physicians during a break time, and it was all about interoperability. So, I had one conversation with an ER doc who literally sees AltaMed patients, amongst many others, but he's working in several hospitals that are just surrounding our clinics within miles. And they're completely different. They're blind.
Yeah.
Right? Our providers, when they, after having gone to the ER being hospitalized, have no idea what's happening. They have no notes. You have to request it. You never get the notes on time, right? So, can AI help with this interoperability aspect, and what are the opportunities? So I think there's we're scratching the surface. There's a lot more that can happen.
Yeah. That's fair. Although I would argue that the business processes are the impediment to interoperability versus the technology or AI,
Totally
which
agree.
I think could do it. So,
Totally agree.
Yeah, but you're right. It's an opportunity for us to serve patients so much better, save costs, et cetera. So,
I mean, once you get this continuity of care document or all the like the ADT alerts, trying to figure out, you have these requirements, but do I really need an ADT alert for when the patient arrives at the ER, is admitted to the hospital, then changes floors, and is discharged? Do I need that many ADT alerts, or is there a better way of presenting that sort of information? Right. Same with the continuity of care document. It's structured format, but is there a way, right? So there's always opportunities. But yes, the
right.
data, you got to clean up the data first. Totally agree with you.
And you're right, consuming it, right? We can give you all the data in the world, but if you don't have a way to easily consume it, then what did you accomplish?
And parse out exactly what's useful. Right, exactly.
I love that. Well, we always like to wrap up these episodes with a little career discussion, as you know, as a regular listener. But what would you say is maybe the best piece of advice that you've been given in your career?
Yeah, I mean, I love this question when you ask it of others. I don't like it when you...
So the best advice is listen to the CIO podcast.
Best advice, honestly, I think, I don't know who told me this, but it was something to the effect of never stop learning, right? You always have to be curious. And so to me, that's why I listen to a lot of podcasts. That's why I'll try to read. I'm more of an article reader, right? I'll read some books, but my limited attention span probably, is better suited for reading a lot of articles. So trying to figure out that balance and making sure you're always natively or innately curious and wanting to learn more.
Yeah. I'm the same way, but you know why I like articles more than books? Books feel outdated.
Yes.
And articles feel fresh.
Yeah.
And maybe that's not always true, and there's certain topics where I should go deeper maybe, but like that's why for me, and maybe I'm ADD too, but I'll accept this.
No, but you're right. The publication cycle, right, for releasing an article versus a book, right, there's a big time difference, so it does make a big difference.
I like the real time.
Yes.
Eric, this was awesome. I appreciate you taking time to sit down and talk with us during the busy conference and share your experience with the KLAS Arch Collaborative and some other efforts that you're doing. And I want to thank everyone for watching and listening. If you want to find more great healthcare IT content like this, be sure to check it out at Healthcare IT Today or search for the CIO podcast by Healthcare IT Today on your favorite podcast applications. Thanks, Eric.
Thank you, John. Appreciate it.